So this video is to demonstrate manual removal of the placenta and internal bimanual compression. The scenario is I have a G5P5 client who gave birth approximately 20 minutes ago. She has lost 1,200 cc's of blood at this point, despite having received 2 doses of Pitocin, 10 units each, 5 minutes apart. And I have just followed the umbilical cord up into her vagina, into the cervix, and I don't feel the placenta waiting there to be born. So I'm assuming that this is a partial separation of the placenta. And that's where our story begins. Okay, so I just got done following the cord up into your vagina. I didn't feel the placenta there. I think that the placenta is only partially detached. And because of that, I would like to, or I need to attempt manual removal of your placenta in order to stop or control the bleeding. Excuse me. So I'm going to put on sterile gloves, the long ones, fresh gel gloves, and with my non-dominant hand on your abdomen externally, I'm going to have that on the top of the uterus, and with my dominant hand, I'm going to enter the vagina with my hand as small as possible and go into the vagina very gently and through into the cervix, into the uterus. Once I'm so now I'm in the uterus, I'm just sweeping around the edges of the placenta to find where it's separated, and I found where it's separated. And at that point, I am going to make sure that my hand, the outer side of my hand, is toward the uterine wall. And I am going to sweep back and forth at the line of cleavage using the outer edge of my hand and my fingertips to cut through that decidua, sweeping back and forth until I get the placenta completely separated from the uterine wall. Once so now I think it's completely separated. I am going to double check by sweeping the uterine wall again. I don't feel any areas of attachment. Of course, I stop this attempt if there were any places that seemed adherent, and then perform internal bimanual compression and transport to the nearest hospital. But this placenta has come apart, separate, or come away beautifully. So now I will grasp the placenta and I will very slowly bring the placenta through the vagina and out, all the while with my external hand maintaining pressure on the uterus externally. My assistant is going to assess your placenta for completeness. And because you're still bleeding, I'd like to do bimanual compression to just control that bleeding a bit more. So my outer hand dominant hand is still on the outside, on the abdomen, on top of the uterus. My other dominant hand will go into the vagina and make a fist, okay, with the palmar side up and into the anterior fornix. And the pressure I am applying is both inward and upward, while on the outside I am pushing pressure down on the posterior side of the uterus, and also I can give the uterus a good massage to help elicit a contraction. Then I'm going to stay this way until the uterus is able to maintain a contraction on its own. There's no more atony for at least several minutes. So every once in a while I'll release the pressure to see if the uterus can maintain that contraction on its own. If it can't, then we'll stay like this through transport and get you to the hospital where they can help control the bleeding. And your uterus seems to be staying contracted on its own, so I am going to very gently remove my hand through the vagina again with my external hand on the abdomen, on the uterine fundus, still massaging to help maintain that contraction.